Well, a good point, because schema therapy is not meant or designed to work on symptoms like depression, anxiety, eating disorders, or something like that, which is more an individual problem. It's actually about interactional patterns, because schema therapy deals with the way we interact with other people. So we primarily focus on something we call personality disorders, interaction problems. And if you work on interaction problems, the problem is the way your client deals with others. So just looking at the client is not very helpful. And even if you manage to make changes in the session, when they come home, they are confronted with the old system. And usually that's what we know from systemic family therapy. If one partner wants to change, the other partner might keep the system up and push them back into the old patterns. So you always run against the wind if you try to change an individual without taking into account how the other person might react. So it's much better at least to use an empty chair and anticipate the reactions, maybe allow your client to sit on the other person's chair watching from the outside at your client, and you can consider how the other partner might react, and you can anticipate that. It's even better if the person is coming in real and you can work on this interaction problem. But it's not necessary. There's already a big gain to work with an empty chair to include and anticipate reactions. I think it's both, because we have an idea, a strategy where we want to go. We have a module system focusing on the three most important steps: stop maladaptive cycles, escalating fight-fight loops at least, and then the next step, try to rebalance and build up a more willingness to connect with the other person, no longer regard them as an enemy based on your schema activations, regard them as your enemy, but step out and broaden your scope and get aware what is the purpose of this relationship. It's not battling or not arguing. It's being more effective, or maybe feeling well with the other person. So that's the second step, to reconnect the couple emotionally. And the last step is to teach them how to talk. And we use the smartphone metaphor because they are both trapped on their side, watching one side of the smartphone. You see the camera, I see the display. And we need to help them to turn the smartphone and actually accept another view as valid, as serious as their own one. And this is the third step, to help them to talk fairly and cooperatively. So this is our strategy. But on the other hand, we have we adapt to the process. That means we have we can adapt and choose the modules depending on the progress the couples make. So it's not rigid manual, it's more like a toolbox. And the therapist basically goes through these three steps. But there are additional modules, or a number of modules, 12 plus 3, maybe 15 modules. And like using a tool from your toolbox as a plumber, you can decide, okay, I need the screwdriver, or I need the forge, or something different. So it's a combination of strategy and being adaptive to the process. Maybe I can demonstrate it at best if I actually stand up, so you can see a little bit of my legs.
Sure.
Just a little bit. So it means the idea is we all interact in a dimensional space between going more into externalization, getting active, try to set the stage, get my agenda through, take space, push my ideas into the world. This is what we call the red leg. It's the road to externalization. But it starts with just getting active. So when I speak, I'm on the red leg because you are ought to listen. That's not taken for granted, because in a fighting couple, they both talk. They are both on the red leg and they try to struggle with the other person, and they both are on the red leg talking. And it doesn't work, of course, because an interaction is only fertile or fruitful if it's balancing between getting active and getting more responsive, reactive. So the blue leg is being cooperative, opening up to the opinion of other people, giving space, being more, giving in more, sacrificing a bit more, up to submitting or self-sacrificing for your kid, for example. So this is the pro-social part, where we think in terms of connection in a good willing way, and more in a parasympathetic stance. That's relaxed. That's how we want to feel. And on the other side, we are able to activate the sympathetic branch and then get more into this pushy, active, externalizing position. But we need both. So like walking, we need both legs. Because if I'm too much on the red leg, I'm too much self-absorbed, I lose the other people. I end up lonely. Nobody will really like me. If I'm too much on connection in a good, willing, submissive way, I will lose myself. People will like me, but I lose myself. So it's about balancing, like walking on two legs. We constantly balance between these poles of internalization, externalization. That's the idea of the two-leg model. And the front stage and backstage model is kind of different, but maybe I can show you a little bit what I mean here with my bears. So if you, on the front stage is our behavior, our visible behavior. That's what we see, what we show to other people. But inside, there are always two poles. The more vulnerable pole with the attachment need, more going to the blue leg, and the assertiveness need, trying to express myself, red leg. But it happens that a person, based on their schemas, feels primarily vulnerable. A woman, for example, caring for her kid, being anxious that the kid might, if it comes home too late, it get, let's say, raped. Then she's basically anxious inside. But the way how she shows it on front stage might be kind of inverted from the vulnerable side into a more pushy, dominant side, when she tells, you have to be home at 10, otherwise you will get raped. That's dangerous. The child doesn't feel the fear. The child only fears the dominant, more front stage, red leg presentation. And in therapy, it's about acknowledging the presented coping mode, the behavior, but then dig deeper and say, okay, what is the active emotion, but what is the other side, the other leg, the other need? And then enable the client to actually convey her problem and say, hey, I'm worried. There might something happen. You heard about the newspaper, so please do me the favor. Be on time, or at least give me a message. It makes me calmer, then I can sleep better. And this is more the invitation to the other person to react on the cooperative side. And this is why it's more effective to use the power of showing vulnerability to create more connection, a good willing connection. And this is what most couples actually need to shift from the more activated, externalizing red leg side back to the feelings at the beginning of the relationship, more when they're honeymooning, they're more open, more interested. This is the healing side. In very simple words, of course. So, the problem is that we are always driven by our inner world, by our schemas that push us to expect what we already know. This is, in psychodynamic terms, this is projection. And this is the trap. So to help the couple to get out of this trap, they first need to shift the gear out and go into this observer mode, how we call it. That's the first step of the healthy adult mode, is actually stopping, getting out of the doing mode into a being mode, into observer mode, and say, okay, everything is okay. What is the behavior? What is the emotion driving? So then go to this mode awareness. And the next step is, okay, where do you really want to go? What is your overall intention? Reconnecting with the attachment side, mode balance or mode choice. And then we do mode choice in terms of what is the right strategy to solve your problems more effectively. So we need to shift out of the schema activation and go to observer mode to regain flexibility, both partners. And up here, they can form a task force to solve their problems, but they need to join their view, the whole picture, on the whole picture, and overcome their limited scope, their horse blind scope in the schema activation state. This is where the trouble is on the process level, in the doing mode.
We actually stand up.
Yeah, so we try to get out and float above the automatic pilot processes. And then we can open our mind in the present moment to reconsider, where do we really want to go? What are our values? Why do we have the relationship? Yeah.
Sure.
Yeah.
Thank you very much, Eckhard, and see you this fall.
You're most welcome. See you and have a good time.